Good evening, everyone, and welcome back to Livayo Talks. I'm your host, Preetika Karnik, and today we'll be exploring a topic that is very relevant to all of us, which is diabetes management. And we're here with Dr. Jyoti Lakhani today. She is the founder and chief physician at Ayur Healing, Ayurveda and Panchakarma Clinic in Kolkata, having more than 15 years of experience in the clinical practice, research, and education field of Ayurveda. She holds a Master's of Psychotherapy and Counseling, a Bachelor of Ayurveda, Medicine and Surgery from Karnataka University and Rajiv Gandhi University of Public Health Sciences, Bangalore, respectively. She has expertise in treating both acute and chronic cases using only classical Ayurvedic formulations, along with Panchakarma, meditation, and yoga. And today we are honored to have her live on this session. So thank you, Dr. Jyoti, for being here. And
Thank you
thank
and
you for
namaste
being.
to all.
So, to get started, let's just touch up a little bit on this topic that we are here to discuss today. So, in contemporary India, in today's day and age, diabetes has emerged as an alarmingly prevalent health condition. It's become so common. We find at least one family member today grappling with this metabolic disorder. The
Absolutely.
surge in its occurrence can be attributed to the following: sedentary lifestyles, poor dietary health and habits, and other contributing factors that we will be discussing today. It is a condition that, if not managed well, can result in tragic outcomes. And most ironically, it's a condition that can, in fact, be easily managed. So, without further ado, let's have Dr. Jyoti provide her insights and her expert opinions on this matter and shed light on how Ayurveda offers a very promising approach to managing diabetes. Now, to get started, some data points for us to understand the gravity of why and how diabetes affects us all. So, according to data from 2014, 8.5 adults aged 18 and above, I'll repeat that, 18 and above, suffer from diabetes. In 2019, diabetes was responsible for 1.5 million deaths, with 48% of these deaths occurring in individuals under the age of 70. Now, this tells us that diabetes is taking the lives of the youngest and seemingly healthiest of us. So, to start with, Dr. Lakhani, could you please explain what is diabetes for those of us who are familiar yet unaware of what exactly it is?
Yeah, hi everyone. This is a very important topic as we have seen the depth of its side effects or it is affecting the population today. I think this is the right time to tell people about its awareness and why it is happening, what are the symptoms, how can you reverse your diabetes. So, diabetes basically is a group of metabolic diseases or syndromes marked by the high level of glucose resulting from defects in insulin production, insulin action, or both. Production and action both. Diabetes may lead to serious complications in multiple organs. This is the common thing which we see. In Ayurveda, since I am taking the Ayurveda part in more limelight, because people need to understand in an Ayurvedic way more rather than the only modern aspect of it, because since Ayurveda is an ancient science, it has the capability of telling you in depth of a disease. Understanding of disease is much better, has been explained in Ayurveda compared to any other explanation, like the causes, the way it is acting in your body, the way the disease is formed in your body has been well explained in Ayurveda. So I am taking that part like of more because I think that is much more required by the generation this time compared to any modern explanation you can read or know anywhere. But Ayurvedic part of this explanation nobody is going to tell you. Since in Ayurveda it has been called as a combination of symptoms. Disease, it is occurring only when it is becoming the chronic after some stage. Then we call it as madhumeha or diabetes mellitus, जिसको हम लोग normally कहते हैं. Otherwise, it is a common term is used for the diabetes is prameha. Prameha is metabolic syndromes. This is just few symptoms which one feels it might be a start of or like pre-diabetics. We can compare this as pre-diabetic symptoms or just starting of the disease. So in Ayurveda, because we should know that when we are in a stage where the disease has just started, it is very easy to control and reverse the condition. Whereas when it becomes the chronic, it becomes very difficult to control. But still in Ayurveda, there are chances that you can reverse your diabetes. So the main problem in Ayurveda, it has been mentioned that there are like two types of, again, like in allopathy, it has explained is like diabetes type 1 and type 2. Type 2 is mainly from your physical activity, your metabolic state, and your daily to daily activities. And type 1 is because of your hereditary, some defect in your insulin consumption, in some defect in the beta cells. There is a defect in your, it comes from your hereditary, it comes from your genes itself. That also can be corrected. Ayurveda has the power to reverse that also, that condition also. But still, these are the types which are explained in modern, and in Ayurveda they are called as Jatyaja. Jatyaja means which you have acquired from your hereditary. So again, that has been explained in Ayurveda very well. At the same time, another type, in which also there are two types mentioned. One is the person with the obesity, one who is tholya, and one is tarshya, the person who has diabetes with the slimness. The weight loss is more, and in one diabetes there is weight loss, weight increase is more. These are being explained in Ayurveda. Basically, what happens in diabetes, that there is insulin resistance or impaired insulin secretion and increased glucose production. There is not increased glucose production. The glucose production might be normal, but it is not being absorbed by your muscles properly. In layman language, what we can say is there is, because of your some disturbance in your metabolism, the sugar level in your blood increases, which is not being absorbed by your cells properly, and that causes the increase in sugar levels of your blood, and that causes some symptoms in chronic stage. If we ignore these things in the starting, they end up in defecting other parts of your body, and that causes the complication, and it becomes a disease proper, which is called as diabetes. So basically, in Ayurveda, if we say this is a type of metabolic syndrome which can later convert into a big disease. It comes under the in Ayurveda there are eight main diseases, Ashtavad Vyadhi, which are very difficult to treat or which have been given the topmost priorities among the diseases. It comes under that category. So if you
Okay.
ignore diabetes for the longer time, it becomes the asadhya, means very difficult to treat. So that is normal explanation we can tell people about what Ayurveda talks of diabetes.
Okay. So, Dr. Jyoti, you gave us a very deep insight into how Ayurveda considers diabetes. Now, as we know, diabetes, we think of it as a disease directly. But what I learned from you today is that Ayurveda takes it in stages. It identifies those symptoms, which can then transpire into a much more serious disease. And there is insulin resistance and how the glucose isn't absorbed properly. You also mentioned prameha and madhumeha, if I'm not wrong. Could you just
Yes.
touch upon these two terms so that we are aware?
Go ahead. I hope you should. Can you hear me? Am I audible? Am I audible?
for that short video to give us much more of an insight into diabetes and a little bit about the topics we will be discussing going further. So, coming back to Prameha and Madhumeha, the terms in Ayurveda. So, if you could quickly help us understand what these terms mean, it would be great.
Yeah, basically in Ayurveda, every disease has been described in the form of stages. So
Okay.
Prameha is very early form of Madhumeha. It is
Okay.
kind of pre-diabetic symptoms. In Ayurveda, you are able to diagnose at very early stage. Before, after 10 years, like suppose you're going to suffer from diabetes, proper disease, you're able to diagnose it at least 10 years back by
All
few
right.
symptoms.
Okay.
Yes, there are lots
Okay.
of symptoms in body, like one simple example of like having ants running through your urine. So this is one simple example. And like you feel thirsty more, like
Okay.
maybe you don't have diabetes proper, but you might
Mhm.
have these symptoms previously. You're
Mhm.
obese, at the same time you're not active. There are
Okay.
two kind of obese people we see. One who is active and all the systems are in balance. It's just that the adipose tissue is much more. Another
Mhm.
person is like in Ayurveda. If you here I want to elaborate one kind of one shlok here, which has been mentioned in Ayurveda, that what are the reasons actually behind the diabetes. So from there we can easily recognize the pre-diabetic symptoms and diabetic symptoms, and for the person who will be more prone to get diabetes in future, the person who
Okay.
sleeps a lot, like it is called as asya sukham swapna sukham, ददनी ग्राम्य ओदक अनुपमांसा पयंसी नव अन्नपानम गुड़ विकृतम च प्रमेह हेतु कृच सर्वना. That means you might not be able to understand that. I would like to elaborate it.
Yes,
It's called
please.
as Asya Sukham, the one
Okay.
who loves to sit on a place for longer time.
Okay.
He just wants to sit. We know in our category that there are a lot of people who just sit on a place, they don't move at all. They love to sit, they don't stand up, they don't walk, they love sitting in a single place for longer time. More than 1 hour, if you sit in your place, it's like 1 hour of smoking you're doing at that time. It has
Oh,
that
wow.
effect. Typically, it has been proved in that way. Plus, you love day sleeping, and like after lunch, you just have to go to sleep without any reason, without any delay. In that, after lunch, I just need to sleep. I need to sleep down. That if you are very much prone to diabetes in future. That is one of the major reasons for kapha
Scaring
vikruti
me a
in your
little,
body.
Dr. Jyoti.
Yes, yes, yes. In Ayurveda, so many things I've mentioned. And along with this, if you love curd a lot, curd has the capacity to
What?
increase. If you're taking a lot of curds is like, in modern sciences and in these days in diet, they mention curd a lot. But I am
Mhm.
absolutely against this. This only can be taken if your digestion is very good. If you are a
Okay.
very good, yeah, curd is not for everyone. Milk and milk
Okay.
products or animal protein is not for everyone. So in
Okay.
Ayurveda, there are plenty of things which people need to know and correct themselves. Why there were so many, there were not so many diseases in previous years. Why it is occurring from last 50 years, when people are so much conscious about their health, they are following
Mhm.
the diet, they are following a lot of things, still they are having this heart attack very frequently. Every
Correct.
person is prone to diabetes these days. Every person is having metabolic syndromes. The way of drinking the water, early morning empty stomach water, which destroys your agni, which destroys your digestion. So these things
Okay.
have to be, yes, these things have to be taken care. If you go through the causes of this disease, you will find out Agni Mandya will be the first reason. And Agni
Okay.
Mandya will be caused by these factors. Like you are having like new these grains, the grains which has been taken out from the field now itself. In
Okay.
Ayurveda, it has been mentioned that we should always go for old grains. Old
Okay.
grains are very easy to digest and their qualities changes with the time. They become very
Okay.
light, at the same time they are very nutritious. So it has been mentioned that Gramya Odaka, Anuprasam, taking the soup of some animals and some aquatic animals, which is very common these days. Seafood is very common these days. Seafood is not for everyone. Like staying in a place where seafood doesn't suit you and still you are continuing taking that, that is one of the reasons. And then
Okay.
taking Gouda. These days, Gouda also has like this jaggery. Jaggery
Hmm.
is in its form, but jaggery can only be taken by the person in small quantities, and it only can be digested by the people who is having very good digestion, whose physical activity is lot more than normal people. So those people,
Hmm.
like these are the main, causing factors. And there are details for this. This time is not sufficient for telling me you the plenty of things which is happening these days. So basically, the person who is prone to diabetes is continuously taking any of these or all of these. And
Okay.
now
Okay.
we cannot decide ki, like if a person sleeping in at the day doesn't have diabetes. It is not like that. Maybe the other thing is affecting that person. The
Hmm.
other cause is affecting that person. So these things are the common things, and the symptoms which we see, which has been mentioned, like modern sciences: increased appetite, increased thirst, excessive urination, fatigue and lethargy, unexpected weight loss, and body itching. But in Ayurveda, they had all these symptoms has been mentioned previously at that
Correct.
time only, and with the reasons why this is happening. And how can
Okay.
you, these days what we are doing, we are not doing the conventional method of just maintaining the balance in the numbers of sugar level. We are actually reversing the disease. How we are reversing the disease is by looking at the symptoms, by looking at the doshas, by looking at the dushyas, by looking at the dhatus in persons, and then applying the Ayurvedic scientific way of reversing it, which can only
Okay.
be achieved by going to an Ayurvedic expert, not by doing it themselves. There are lots of methods
Okay.
is coming and people are doing on their own, and it only works for the time being, and then later again you end up with this. But with proper Ayurvedic treatment, like the symptoms we see, like burning sensation of palms and soles, this is
Hmm.
usually very common in all diabetic persons. Excessive thirst. Why there is excessive thirst?
I
Then
see.
yeah, then sweet taste in mouth all the time. Along with this, there are few symptoms which has been mentioned, like heaviness of body, and there are coatings in your inner area of your body, like on your teeth, on your tongue, on the sides of your mouth. All these symptoms are pre-diabetic symptoms which can diagnose, which can help you to diagnose that you can be like involved in the diabetes later. You can have
Okay.
diabetes later. So all these
Okay.
symptoms can be corrected all or can be diagnosed and correct at very early stage, so that you will never end up in disease later. Other than
Okay.
that, I told you, eating like heavy foods, more of snigdha food. Snigdha food is called as like more of oily foods. Ghee
Okay.
in small quantities are always good, but intake of heavy foods, oily foods, all these are the main cause for diabetes.
All right. Now, we learned that Prameha, these pre-symptoms, once they are identified early on, this can help us stop it from getting worse to Madhumeha. So, Dr. Lakhani, I mean, thank you. Firstly, I want to say thank you for, giving us this information, and I can sense and I can notice your passion for this. And we would love to just sit, for 3 hours and discuss this. But yes, and some very interesting facts as well, like with the curd and everything. People will notice me picking that up a lot. But anyway, coming back to the symptoms and how Ayurveda addresses these pre diabetic symptoms to solve the problem. So, could you touch up a little bit on how Ayurveda solves these pre diabetic symptoms or curbs them so that it does not get worse?
See, in Ayurveda, it is very clear. The treatment is very simple. We reverse the cause. It is called as cause and effect. Because
Okay.
anything which is happening in your body has a reason. है ना?
Mm-hmm.
And what is normal conventional method of treating diabetes or any other disease is you continue with the cause. At the same time, they give you some medicines just to suppress the symptoms and
Okay.
not treating it through the root. In
Okay.
Ayurveda, the treatment is entirely different. We consider the symptoms, but we go to the depth of it, why this symptom is coming from, where it is coming from. And what
Okay.
then we do is we work on the cause of that particular symptom, and then we work on that cause and reverse it by stopping that cause. Until we stop that cause, it is
Mm-hmm.
not going to reverse the disease. So
Okay.
Ayurveda attributes multifactorial etiology to the causation of diabetes, and
Okay.
described as one of the, it is, since it is described one of the major eight major disease is called as Ashtamahagada. Ashtamagadhas, which are very difficult to cure and are very refractory in natures. They occur and like you, if you control it once, they occur again and again. You know
Okay.
that type of
Okay.
nature. So the most important things which are going to help in reversing at the same time you can prevent that happening in future is dietary, your dietary lifestyle, your diet, which are genetic. Can you hear me? Yeah, it's
Yes,
fine.
we did
Yeah.
lose you for a bit, but what we heard is, these symptoms can be suppressed and can be helped with changes in your dietary and your lifestyle.
सबसे important in Ayurveda, when we like when Acharya Charaka has discussed detail of this disease in like 1,000 years back, thousand BC. At that time, he has explained that medicines will work very later,
Hmm.
but the diet works at Mahabhashajya. Mahabhashajya means the topmost medicine. The topmost medicine is your food. So at
Correct.
that time only Acharya Charaka was knowing that it is coming from your lifestyle and your food habits. That is why this statement came at that time that only lifestyle and reversing of your diet can reverse the disease very well. And later comes the
Absolutely.
role of, like, suppose if you have complications and if this doesn't work, 99% this works in every human being, but if suppose that doesn't work, you take the need of your medicines and other supplement which is like supportive measures. Okay,
Correct.
so this is very important. So core contributory dietary lifestyle and environmental factors, these comprise, इसमें सबसे ज्यादा क्या आ जाता है? The most important is excessive eating, sedimentary lifestyle, like sitting in a place not doing any physical activity. People these days are habit of, like, just sitting in a place, like suppose IT work, they sit in the morning and get up in the evening, don't have time
Correct.
to. So they have to change. I have seen my most of my colleagues, what they have done is they have changed the place of working in their office. What they have done, instead of this sitting and this chair and table, they have made an table little, like a
As a
little of
standing desk, I
a
believe.
standing table,
Yes.
so that they can stand and do their work at the same time. This is just your awareness. This has
Correct.
to come from inside, that you have to continue and maintain your health. At the same time, you have to work properly, because otherwise you will
Absolutely.
never get time for anything, huh? How will you
Yes,
get time if
Dr.
your
Jyoti.
job is, these days if you're seeing everybody has a job which is like they're totally busy, they don't have
Correct.
time for you know anything. So for that, it is very important that we should not eat excess. This is very important. People today are
Absolutely.
not thinking whether they are hungry or not. No, we have an habit of frequent eating. That is coming from where, I don't know. People just see that this is very good, that we should eat frequently in small doses. No, this is not the criteria. The criteria is only the previous food is digested and then you have to take the next meal. If your body is asking, your body, nature has made your body in the form which is the best teller of everything. You don't need to listen to anybody else except your body. If your body is asking, I need some food, then give some food to your body. If your body is asking, no, it is not going to work like this. So all these things are very important, which are going to help you in diagnosis, and then you can reverse it very well.
Completely agree, Dr. Jyoti. We all know food is medicine, and you will continue to hear this in all our webinars before and after that. Prevention will always be better than cure. So, your
Sure.
lifestyle and your habits are what will contribute to you preventing diseases like diabetes. Now, coming back to some more data and moving on to the next question. So, unfortunately, between 2000 and 2019, this time period, age standardized mortality rates related to diabetes increased by 3%. Now, low to middle income countries experienced a 13% increase in diabetes related mortality rates. So, the deaths in these 19 years have just shot up. So, Dr. Lakhani, I want to ask you, how does Ayurveda address the underlying causes of diabetes, such as poor digestion, stress, imbalances in dosha? So, how does Ayurveda address this? What does it say in the text?
It's very simple. I have already mentioned the causes of it. I'm just
Mhm.
taking little more of it. There are three kinds of causes. One is your hereditary,
Mhm.
another is your diet and lifestyle, third is your stress, which is causing a lot of disturbance in your body these days. So we just need to concentrate on these three things.
Okay.
For hereditary, in Ayurveda, you can work on that. Doctors will guide you how to correct that also. Because since Ayurveda medicines have that one kind of impression that they can even correct things also. Genes also is being modified with the help of Ayurvedic treatments.
Mhm.
Number two is your lifestyle and your habits. That is totally on you.
Correct.
You need to understand, and for that you also need to go to this Livayur. They have this very good in livayur.com. You can go and find out your dushas
Yes,
along with,
the dosha
yes,
tool.
there are a lot of things, yes. So when we talk about this diabetes, it also comes under the type of vataja, pittaja and kaphaja. So depending upon your particular like form of diabetes, you can find out your types and then you can work accordingly. Third is
Okay.
stress, which can be only controlled with the help of meditation. Because today everybody is running, if they're running like anything, they stress comes from your past things and your future things. In present there is no stress, so we need
Mhm.
to learn to get ourselves go into meditation. Sahaj yoga meditation is the best. The personally I feel it's a scientific way of balancing yourself. By that what you achieve is a total stress free life. Why?
Okay.
By how? By deviating yourself into thoughtless awareness. Thoughtless awareness means when you are in your present, not in your past and
Correct.
future, you can be your best form. So that can be attained through meditation. So I think instead of working on other things, we should all work on meditation. The food habits according to your type of dosha, and third is your lifestyle. Working, physical exercises, yoga, all this has to be done along with whatever you do. If you're getting time for
Absolutely.
eating, if you're getting time for sleep, it is equally important to get your physical work done. It is equally important. You cannot ignore that because if we talk about diabetes, there are less movement in the muscles and sugar is not being digested properly. If we do not move our muscles, how sugar is going to be absorbed properly? Whatever medicines you go give, it doesn't going to affect that, because it is only going to affect by improving your metabolism, by improving your circulation, and by improving the movement of your muscles. So it is coming from
Absolutely.
something inside. It will not work until unless you correct that.
Sure, Dr. Jyoti. So you've shed insight on the root causes, right, which is hereditary, diet and lifestyle, and also stress factors. And you've also spoken about how each of these topics can be handled through Ayurveda, through what you spoke about, which is meditation, yoga, eating according to your doshas. Your hereditary can also be addressed through Ayurveda. So that is also something we'll come to towards the end of our session. Now, are there any specific Ayurvedic therapies or treatments that can complement our allopathy or conventional medical approaches for managing diabetes?
Yes, there are a lot of things. See, I what we do in our practice these days is we try to reverse the cause, and
Hmm.
that works very well. In my clinical practice, I have seen I have let people leave their modern medicines completely. It's
Okay.
been 2 3 years. I'm checking their blood sugar levels, their HbA1c levels. That is average blood sugar levels in last 3 months, and it is coming absolutely normal. People are
Okay.
actually what do you say, I should not say it, like they are actually reverse their diabetic condition.
Hmm.
Absolutely. In that now I have seen there are three treatment kind which have worked a lot. One is
Okay.
the person who is able to control his diet and physical
Okay.
activity, that can be reversed with the help of few medicines and diet.
Okay.
Second is type of people. In them, I have used the Panchkarma therapies, which has been mentioned in Ayurveda.
Okay.
They worked very well. They worked
Okay.
in cleansing the body and then establishing their metabolism, and then later on medicines along with that it worked very well. Third is kind of people. It's a conventional method that you give medicines and their sugar level will be normal and
Hmm.
everything will be like but it will not reverse the condition again.
That is just
Okay.
suppressing of
Yes,
symptoms
it is
as
just the
well.
suppression. Whether it is allopathy or Ayurveda, the only difference here is that it is not going to give you side effect until unless you are taking the treatment under a doctor.
Okay.
consultation.
Okay.
Self medication is very dangerous in case of anything. I'm telling you, I'm telling this in every webinar or live sessions, that please don't. Ayurveda is not your kitchen things. Ayurveda
Okay.
is proper scientific treatment which only a doctor can understand your stage, your type, and then the treatment should be given. It is not a generalized treatment that this should work on everybody. No, it doesn't
Mhm.
work like this. Every patient has different prakruti, different. That's what I told, that livayo.com has a very good tool to know your prakruti, and then you will be able to identify yourself. That helps you to prevent lot of diseases. ठीक है ना? Scientific approach, always go for scientific approach. Don't go by
Correct.
yours. No, 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 no. Ayurveda is a scientific way of controlling, and Ayurveda is a scientific way of treatment. It is not only just somebody has told me to do this, I'll do that. Karela will help. Karela doesn't help everyone. Karela will help only those whose digestion is very good. Who the one who is able to digest is Karela very well. There are a lot
Mhm.
of people I have seen that they get immediately infection with the Karela. But do we recommend? We normally say that jamun, Karela, neem, all these are very good medicines for diabetes. But again, diabetes is a very complex situation. You cannot treat, if everybody get treated with these only, then everyone can have this Karela jamun and treat themselves. No, no.
Correct.
We should always go by scientific way. And even you have to take these medicines. I will tell today even the name of few medicines that
Mhm.
cannot be taken on their own. You only have
Correct.
to appear for consultation also. You will have to find a good doctor around you, and then you take the consultation. So for
Correct.
diabetes, I'm telling you, there are two, three methods. One
Mhm.
treatment approach is by changing their lifestyle, their
Mhm.
food habits, and their physical workout with very few medicines, which helps their that medicines we require, because diabetes, if have done some internal damage, that can be corrected with those medicines. Second is with Karma therapies. They are very good. They work very well. I've seen people getting corrected by that. And
Mhm.
third is conventional method, that we just take medicines under consultation, which suppresses the symptoms for the time being. And if you leave the medicines, they will come again.
Come on.
It can come in, it can happens in Ayurveda also. It is not like
Okay.
that by taking medicine you can correct yourself. No, nothing like that.
Okay. Okay. So diabetes is all I can hear. Diabetes is
And one
notorious.
more thing I want to add. In
Yes.
Ayurveda,
Yes.
particularly, it has been mentioned that Stolya Prameha and Karshya Prameha. The person with heavy body has a different kind of treatment. Person with the slim body has a different kind of treatment. That has to be taken care before treating
Okay.
any diabetic patient.
So some quick points here for our viewers. Ayurvedic medicine and Ayurvedic treatments is scientifically backed. It is not for self-diagnosis and self-prescription. Please consult an Ayurvedic doctor like you would any other doctor, and then only go ahead with treatment. So if you, at all you feel symptoms, please don't go to your kitchen and eat some Karela. That will not help. So coming, just kind of elaborating or going further into the combination of allopathic medicines and Ayurvedic medicines. Now, let's say a person is taking an allopathic medicine. Would Ayurveda in some way interfere, or vice versa? If someone has started Ayurvedic treatments, would taking allopathic medicines interfere in some way? Can they work synergistically together?
Yes, never. I recommend that people should not combine two pathies together.
Okay.
You need to understand every pathy differently. Allopathy people will not be able to understand the scientific of Ayurveda, and same with the Ayurveda. Ayurvedic doctors will not be able to understand the scientific way behind, uh, you know, allopathy science. So two pathies can never be mixed, and I don't recommend that. I am
Okay.
I'm sure about that, that Ayurveda can reverse and cure diabetes very well if you will be able to follow doctor's instructions, and you will take your consultation proper, and if you're ready to do hard work by
Mhm.
correcting your lifestyle and management, it is
That's the
going
first.
to affect. So I am
Correct.
not in favor of, I tell my people, either you follow allopathy or you Ayurveda. Mixopathy is not allowed.
Okay.
Mixopathy is
Okay.
always dangerous. You should
All
not.
right.
And it might give you then side effect, and then people will say that Ayurveda medicines have this effect.
Okay. Okay. So
Okay.
we will
One
keep
more
that
thing
in
I
mind.
would like to add in this, that in
Mhm.
diabetes, it is very much because since it is an autoimmune disorder again, so
Mhm.
immunity of the people is getting low because of their bad digestion. So what
Okay.
happens is, like, we have to take care of our immunity by reversing the metabolism. And if your metabolism is very good, we can use some like some compilation of medicines, or some good like, in a good formulations you can add, which will boost their immune system, because they usually suffer from recurrent respiratory infections, or they usually suffer from very weakness. They are unable
Okay.
to do their work properly. These are the very common complications you see in an diabetic patient, that they're having pains in their lower legs, their
Okay.
bowel movement might not be clear, or they are having low energy. They are usually these are very common symptoms you see in an this patient. In that also, Ayurveda plays very important role.
Okay, okay. So for the viewers, each way of treatment is good and right in its own way. Just remember to consult with a trained medical practitioner. That's all you have to keep in mind, as every body is different and everyone's illness will be different. Now, we had mentioned earlier in the webinar that diabetes, when left unhandled or untreated, it can cause effect, or it can cause a negative effect to the rest of your body and to the other parts of your body as well. So
Absolutely.
we know from a data point here that diabetes caused an additional 4 lakh deaths due to kidney disease and hyperglycemia, and this also contributed approximately to 20% of cardiovascular deaths. So diabetes can be notorious if left untreated. So Dr. Jyoti, are there any specific Ayurvedic herbs or formulations that have shown promising results in supporting individuals with diabetes already?
Yeah, there are lots of. You see the research papers, you will come to know there are thousands of medicines which are supporting diabetic complications and diabetic condition itself. Among
Mhm.
them, few are very, like, there are, that's what I was talking about. There are amlaki, there is methi, there is shilajit, there is jambu, there is guruchi. Giloy has a very good effect on diabetes itself. Then we have some good classical preparations like Vasant Kusumakar Ras. We have Trivanga Bhasam, Falatrikadikwat. All these are Nisha Amlaki. We have Kathakadiradi Kwatham. Plenty of medicines are there which are working very well. But again, I'm telling you, I have
Mhm.
taken the names only just because it is like you asked me this question, but I don't recommend anybody to take self medications at all,
Okay,
because you
correct.
don't know for how much quantity you need to take this, like how you are going to take this in a small quantities or in a larger quantities, or at which stage your disease is, you are of which type, whether
Mhm.
it is going to suit you or not. There are plenty of things which you don't know, which common
Mhm.
people have zero idea. So don't think again this as a kitchen therapy. It is not, it is a scientific way of doing it. So all these medicines can help. Along with this, some formulations I have seen, like, Kesari Jeevan, and this Chavan Prash is very good. This is very these are very this Kesari Jeevan fit for diabetes. I have seen the very good effect there, because since the immunity is very down in the person, so this saffron and pearl, they helps in improving a lot. Pearl has the capacity to reduce pitta dosh in your body. At the same time, it provides calcium level. It increases the calcium level also. So instead of taking it in separately, this combination works because it has the proper quantity of them in these content in them. So it is very good. It supports your system. It helps you a lot. Along with this, you can
So the two medicines that Dr. Jyoti mentioned were number one, Zandu Kesari.
aware of same case.
Oh,
We need to understand Chavan Prasad, and these two things have no sugar in it.
okay, that's
Since
very
the
interesting.
Yeah, since people are very weak in immunity, so
Mhm.
these two things are going to help in building their immunity. But I'm again telling you, it can be taken under doctor consultation. At the same time, it if it is required by you, then only you must take. Because
Okay,
if your
so
digestion is not good, you're not able to digest it, then how it is going to provide immunity in you? So that
absolutely
have to be taken care. And it has amlaki. Already I've mentioned the names. It has
correct.
the shmula. It has plenty. Since the weakness is there, these are all supportive measures you can take along with reversing your disease properly in a scientific way. ठीक है ना?
Okay,
तो
so
since
just
in
to
the
touch,
case,
yes,
uh,
just to touch back up, we have Zandu Kesari Jivan and Zandu Chavan Prashad with
Sure.
all the herbs that we just spoke about in the right quantities, and they are both sugar free for
The
made
sugar.
especially for diabetic patients. Now
One
we
more thing I
spoke.
would like to tell people that sugar
Yes,
is not the cause for diabetes. Not proper absorption and digestion of sugar is the cause for diabetes. So
yes.
it's not that sugar is bad, but our metabolism is bad somewhere. That
Hmm.
is causing it. So we should correct. We should work on other things rather than just not taking sugar from outside.
Correct.
It's not. It's
Absolutely.
not the solution.
Absolutely. And many times we refer to diabetes itself as sugar. So that has probably changed, our awareness about it. Now, we've spoken about lifestyle, we've spoken about the changes to make in our diets to help with diabetes. So, what are the dietary recommendations that Ayurveda offers for individuals with diabetes?
Again, it depends upon person to person, but still I will take the light diet without oily and ghee things, without much of spices. Always go for the food which is very easy to digest. In Ayurveda, mugda means green moong dal has been recommended by all.
Okay.
Barley is very good, java is very much indicated. You should go for the diet according to your body, but I preferably go for a diet which is very easy to digest. Your body doesn't have to put effort to digest your food. Food
Okay.
should be like this. At the same time, the food should be nutritious.
Okay.
It should give you all scientific nutrition required by your body, but it should not be difficult to digest. It should not cause toxins in your body, and it should be very easy to digest. So that
Okay.
kind of food, which is like rice, is very good. Roti is good. Green vegetables is very good. Green moong dal, yellow moong dal, these are very simple food you can have, and you can correct your body.
Okay, so light, nutritious, easy to digest food, which
Food.
I'm sure a lot of the food that we make at home follows these rules, right? So just make sure you stick to your traditional diets, and a lot of the problems can be solved. And coming to all the information that we discussed today, it would be great if, there was an ebook of some sort. So is there a place or a repository where we can find all this information that we touched upon today?
Yes, yes, you have asked me a very good question of this. People should be aware of this, that we have livayu.com has the ebook facility where you can go and find all the information regarding your any disease, not just diabetes. There's plenty of information you'll find in that. So just
That's
go
great.
liveayur.com. It's very good site. You will come to know plenty of things regarding your lifestyle and everything.
Absolutely. Thank you so much, Dr. Jyoti. I also have to make a point of going and reading through this because we've learned so much today and it's all been so helpful and so interesting. And we've also spoken about dosha and how that helps make our dietary decisions. And as we mentioned a few times, there is a dosha tool on Livayo. So
Yes,
please
it is
make
very
sure
good.
to go and
Yeah, yeah.
check that out. So the links are posted in the chat if you notice. So all the links that we discussed about are in the chat for you to have a look at.
I
Now,
have,
finally,
yeah, please
yes, Dr.
carry on.
Sure. Okay. So, finally, can Ayurveda help prevent the development of diabetes in individuals who are already at risk? Let's say they have a hereditary, line of diabetic family members. So, if they are at high risk, can Ayurveda have some preventive measures?
Yes, definitely. I've touched this topic already. That by
Okay.
correcting your lifestyle, people, I think these days now we should create some awareness programs in public. We
Okay.
should do
Correct.
this in office.
As Dr. Jyoti is mentioning, it always comes down to lifestyle choices. And Dr. Jyoti, like you mentioned, awareness in public. So
Yes,
I
we
think what
should
you
be.
mentioned is yes,
With
with
our kids also, like suppose we are talking about my children, I am telling them what is the best food they can have, how this normal chips has this palm oil in it, and how
correct.
it is going to affect their metabolism. So they should know, if suppose once a week they had this chitter chat, but
Hmm.
rest of the week they're not supposed to take it. How?
Correct.
Not just by forcing it on them, by just educating them. So
Yes.
education, telling the I am damn sure if people will know proper Ayurveda na, they will
Hmm.
never end up in a disease. I'm telling you. And if they end up also, it will be very small. So start educating people about this at very early stage. We should make some groups in that this awareness should be there, that how can you diagnose diabetes at very early stage, or how
Hmm.
you can do these things to prevent diabetes by preventing the reasons which causes that. So
Yes,
how diabetes
absolutely.
is being caused can be that can be explained to people, and people will.
Sure. So honestly, Ayurveda as a topic should be brought back in schools, and from a young age, we need to start
Yes,
learning about
very
it.
young age, exactly. So these days, I'm telling, I'm very happy that people are coming to me in coming to me in very early stage, early, like people are coming to me at the age of 15, 14. They have started believing in Ayurveda so early. So like I'm seeing people awareness. If they have a disease, they search in a Google that what is the best treatment for their this disease.
Yes.
So it's not now. I'm seeing awareness in people, and I would love to see it more in people that like you don't come to Ayurveda at end. I'm
Mhm.
telling this to everyone. Come to Ayurveda at very early stage so that पहली चीज में ही वो ठीक हो जाए. There is no progression of disease. There is no complications. There are the disease should not go into its chronic.
Yes. So we always say that, prevention is better than cure, and this is the best way to seek out
Stage.
Ayurveda
Chronic,
in the beginning itself. So, Dr. Jyoti,
pure
you've
to a chronic.
provided us,
Yes.
yes, you've blessed us with all this knowledge, and honestly, do we have an option of getting in touch with you if we have any problems or just want to consult with you in any way?
Yeah, you can do that, but I would like to add one point which we might have missed, that yoga is very important. Yoga
Yes.
therapy along with this is very important because yoga therapy stimulates auto healing system of body to increase the
Okay.
insulin sensitivity and also removes the complications of prameha. It is metabolic disease in which primary problem is defective utilization of sugar by the body. So sufficient insulin is produced by the pancreas with the normal with the yoga sessions. What you do, which controls the body's ability to store and utilize sugar. So pranayam definitely increases the natural immunity, whereas other yoga therapies helps to improve your metabolism and circulation, which helps in proper absorption and secretion of the insulin in your body. Since it has a scientific background of control your hormones, so this
Okay.
disease is related to an hormone, so it controls the disease very well. So I recommend people to go for yoga therapy along with this, which works very well. So there are lots of yoga and this pranayama therapy which you should go. Like the common we
Fantastic.
know that, yeah, Vajrasan, Mandukasan, all these. There are plenty of asanas you can do, and they are very good. Dhanurasan, Udarmukhasan, all these asanas, Paschimottanasana, all these asanas help. And Anulom Vilom Pranayam along with Kapalbhati done under proper yoga teacher. It's very
Okay.
beneficial.
Okay.
And you can consult me always on Livayur under the consultation part, and I'm ready to even reply your queries also regarding Ayurveda. If you have any doubts, just come to our website and ask the questions. We will try to reply you. And you can take my consultation from there, livayu.com, under
Absolutely.
consultation part.
There is a link that we will be giving in the chat box. So, Dr. Jyoti, thank you so much for being so enthusiastic about helping all of us. We've unfortunately come to the end of this session, you know, and we do have to close out this session. But as always, we can consult you through Livayur. Now, this was an extremely insightful session. Thank you so much, Dr. Jyoti, for sharing such detailed information.
No,
At
thank you, Livayur, for such a platform. People need to know actual Ayurveda.
Absolutely.
So,
We
it's
speak
very
about
important.
spreading awareness, and we
Yeah.
are here. And thank you, Livayur, as well, for helping us get our audience aware today. So, with this, we'd like to end the session here. And I'd request the audience to drop in any questions, any last minute questions. I know we're a little low on time, but I'm sure we have some time to answer a few questions. So please drop them in. And remember to follow our social media handles for regular updates and about Ayurvedic lifestyle, about Ayurveda, and any other webinars that are coming up. So, thank you everyone. Do drop in your questions. We'll try and answer a few. So, just checking if we have any questions from the audience. Great. So I don't see any particular questions as of now, but that's absolutely no worries. You can always drop in these questions to Dr. Lakhani personally, and we can address them individually. The consultation link has been provided, so feel free to make use of that and all the resources that have been dropped in the chat box. So thank you everyone for making time to be here. Thank you, Dr. Jyoti, once again for giving us these valuable insights and helping us be more curious about these diseases and the changes that we can make. So thank you once
My
again,
pleasure. My
and
pleasure. Thank you so much.
thank you everyone, and good evening.